Hello and welcome to the calfcare.ca webinar series. My name is Dave Renaud. I'm a veterinarian epidemiologist working at Acer Consulting and also the University of Guelph. Over the next 2 hours, we'll explore some of the reasons as to why do some calves thrive and others die. And specifically, we'll explore risk factors that are impacting dairy calf health. We'll talk about some opportunities and how do we collect data on dairy farms so that we can actively explore how to improve calf health on farms. If you think about what we're trying to do with calves, we're trying to have a healthy and productive calf that's growing well. And that's really the goal of what our pre-wean period is. So we want them to grow well in the pre-wean period, through the post-wean period, and really be a productive and healthy first lactation animal. But there are many barriers towards calves being healthy and productive. We have high levels of mortality, we have high levels of morbidity that really reduce the opportunity for that calf to be healthy and successful. And through this presentation, we'll talk about all the challenges associated with morbidity, all the challenges associated with mortality, and how we address that on farm. So think about, you're driving down your client's laneway, you're going to do a herd health visit. What are the things you think about? For me, when I'm going and doing this, one of the main things that I'm thinking about is reproduction, because that's what we spend the majority of our time doing. However, if we go and we talk about calf health management, we discuss some of the areas of opportunity, I think we can have a big impact on motivating our producers to change their management practices. However, many veterinarians aren't necessarily focused on calves, especially around herd health. And this is a survey of producers that we did at the Healthy Calf Conference in 2018, where we surveyed about 500 dairy producers. And what they said that their vet, we asked them what their vet spent time at herd health doing. And the majority said that the majority of the visit was tied up with reproductive management, and a small proportion was on calf health management. We also asked their advisors to provide, how often they provide advice on the health and performance of calves. And for veterinarians, only 20% always provided advice on it, 40% sometimes did, 30% seldom, and 15% never. So I think if we can start having discussions with our producers about calf health management, not only the health side, but also on the performance side, we can have a significant impact on motivating them to improve. Through this presentation, we'll go through 5 key areas of opportunity that I think we can monitor and that we can influence to improve the health, welfare, and productivity of heifers and male calves on the farm. The first area of opportunity is calving management. Calving obviously is a very stressful event for not only the cow, but also the calf. And there's many things that we can focus on to improve this area to reduce the challenges associated with both dystocia and our stillborn calves. The next area of opportunity is colostrum management. There's lots of research that's gone into this to not only show the benefits of ensuring that we get colostrum into the calves, but also looking at the consequences of it, of having not enough colostrum to these calves, and we'll explore some of that as well. We'll explore morbidity and mortality and talk about the challenges that are present in these calves when they get disease and the high levels of mortality that we see within it. And the final thing that we'll talk about is nutrition and all the benefits of providing higher planes of nutrition to improve growth, health, and productivity of calves. We've also bookmarked this presentation to highlight the different areas of opportunity. So as you move through the calfcare.ca website, you can look at calving management individually, mortality individually, antimicrobial use, nutrition, and also colostrum management. And each one will have a different video that you can click on and watch. So calving management. Calving management, like I mentioned earlier, is not only an important thing for the cow, but also for the calf. If you think about the risk factors on the cow, you have a 100-pound calf that's being delivered. So you can have internal injuries, you can have internal bleeding, you can have fractures, you can have a wide variety of different things that will impact the cow. If we think about the calf from a calf standpoint, it's equally traumatic. We can have broken ribs, again, internal bleeding. We can have anoxia, the inability for the calf to get oxygen, and all of these can contribute to significant challenges that happen in early life. One of the consequences to having difficult calvings or dystocia is having stillborn calves. Stillborn calf, as many of you know, is a calf that dies at birth or within the first 24 to 48 hours after birth. This graph is from the National Dairy Study, which is a study that went out and surveyed about 1,000 dairy producers across Canada. And what they mentioned was that 5% of the calves on their farm died at birth or within the first 24 to 48 hours. The interesting thing is you see a huge distribution. So on some farms, this is a significant issue, like these ones down here, about 8% or higher, pretty significant issue on their farm. But some farms, it's a non-issue, less than 2%. So not only is this a huge welfare concern, again, back to the consequences like I mentioned earlier, rib fractures being painful, inability to get oxygen, and distress that's associated with that, but it's also a significant economic issue. For every stillborn animal that's born on the farm, it costs the producer about $900. And a lot of that is related to calf mortality, the opportunity cost to not have that animal come in as a replacement in their dairy herd. But we also have the cost that's related to the dystocia event in the cow. So we have, dystocia event. We also have the cost of discarded milk, increased drug and veterinary costs, increased risk of being culled, decreased milk production, and also an increase in the days open. So all these consequences will lead to about a $900 cost for the dairy producer for every stillborn calf they have. If we think about how to monitor stillbirths on a dairy farm, it can be done quite easily. About 70% or 60 to 70% of farms are on DHI or Lactanet and record this pretty regularly in that program. So using Dairy Comp, you type into your command line events /3, and this will give you this calf report or this calf table, which gives you a ton of different information where you have, number of freshenings, you have the proportion of twins, percent females, percent alive, and also percent dead. So on this particular farm, they were 2%, which is a great farm and what you'd strive for. Goal ideally is to be less than 5%, and this is a goal that's been generated by the Dairy Calf and Heifer Association in the United States. So this is an example of a herd that potentially is having a problem. So again, back to the freshenings, 167, alive, dead, percent dead, about 9% on this farm. So this is a farm that's having some challenges, and we'll kind of explore the different risk factors that you could work on if you have a herd that's having a high level of stillborn calves. So if we look at the three main factors that are associated with stillbirth rate on a dairy farm, there's a couple things that you want to consider. The first one is calving management, which is a significant thing that we can really manipulate and improve what's happening with the producer and provide some education on that. There's also the age at first calving and also nutrition, and we'll go through each one of those individually. So if we look at calving management, I think, again, we can break it down into three main factors that we can manipulate to improve calving outcomes. The first one is their movement prior to calving. The second one is their calving supervision that we're providing. And the third one is when we're intervening or providing the right intervention at the right time. So we focus on movement prior to calving. So movement is not an issue as long as the cow is moved, ideally within 2 days prior to calving or at the onset of stage 2 of parturition. And what the onset of stage 2 of parturition means is the feet or the amniotic sac are out the vulva and the calf's ready to go through the calving event. When we run into issues, if we're moving cows at the onset of stage 1 of parturition, that's when we're going to run into some bigger issues. So we might have a longer duration of calving, we might have a higher level of assistance, and we also have a higher risk of dystocia and perinatal mortality. And that's related to these cows that when you're moving that stage 1 of parturition, when the cervix is dilating, they're going to go and they're going to try and start exploring their environment to make sure that that's a safe calving area for them to have their calf. And that's why we have that kind of delay of that or the progression of parturition. So the next thing, like I mentioned earlier, that we can manipulate is calving supervision. And the quality that we do for supervision can have a huge risk or a huge influence on our risk of having a dystocia or difficult calving event. If we look at what the most reliable signs are of impending parturition, just by looking at the cow, we can see if when we start having relaxation of the pelvic ligaments, udder and teat filling, parturition should start happening in about 12 hours. The challenge with that is it's a very subjective measure, so it makes calving supervision very difficult on many farms. It's also hard, calving supervision is hard on smaller farms because we don't have the labor that's necessary to go and provide that 24-hour supervision. One way that you could get around that is through the use of camera surveillance, But I'm sure you've been to many farms that, there's lots of dust on those and not commonly used. And that's because you have to actively go in and look at those cameras. So one of the ways that we can provide better calving surveillance or calving supervision is through the use of monitors. And that really is an active way that we can increase the frequency of observation without needing the labor that's required to do that. So one of the good ways that we can start monitoring calving supervision is through monitoring body temperature. So what happens when a cow enters into parturition, they'll have a drop of about 1 degree Celsius in their core body temperature. And that happens about 48 hours prior to calving. So that'll give the first alert to the producer that parturition is going to occur within 48 hours. Also, when you use these temperature boluses, like the ones that go into the vulva, when they get expelled from the vagina, you also will have another decrease in body temperature. And that will alert that the cow is in stage 2 of parturition. Another monitor you could use is the use of an activity monitor. So activity monitors are really common on farm, mostly through estrus detection. And what happens with these activity monitors is that they'll start to increase the number of steps that they take, mostly around the stage 1 of parturition. So about 8 hours prior to parturition, they'll start to have an increase in the number of steps that they're taking. So that can alert the producer that, hey, something's happening, and within 8 hours this cow might calve. The challenge with it is that there's only about a 70% increase in the activity that the cows have. So many of these activity monitors do not have the proper threshold to provide an alert that this cow is calving, because most of them are set on estrus detection, where you have a 140% increase in activity. Next monitor is rumination monitors. So that about 8 hours prior to parturition, you have about 70% decline in rumination time. And the largest drop occurs in the final 4 to 6 hours prior to parturition. So that's nice because the producer gets provided with an alert to say rumination is dropping, this cow might be close to calving. Another monitor that you could use is one that monitors tail position and movement. And how this particular monitor works is that as cows enter through stage 1 of parturition, their tails will start to be elevated or raised for a longer period of duration. And if the duration of the tail, raising stays high for a longer period of time, it'll send an alert to the producer. And this particularly occurs about 2 to 6 hours prior to parturition, and is a reasonable way to alert the producer that parturition is occurring. So what's gained with using all these monitors? I think what's gained is that we improve our active surveillance of parturition. So it provides an alert to the producer to say, this cow is going to calve soon. And then they can potentially use calving surveillance or go into the barn more frequently to ensure that this cow is progressing over time. The final thing that I think we can manipulate is calving intervention. So if we look at it from a purely academic standpoint, when to intervene, an intervention should be applied when a cow is in labor for more than 70 minutes after the onset of stage 2 of parturition, or when the feet or the amniotic sac are presented to the vulva. The challenge is it's really, really difficult for a producer to identify, that the onset of stage 2 of parturition and really time out that 70-minute duration or window. So a more realistic way to intervene is really to examine the cow when you first see her in parturition. And an intervention should be applied if the amniotic sac has brown, red, or fetid fluid, or there's cotyledons present, if you see that the tongue, head, or feet are swollen and cold, if you have malposition of the calf, if you have twins, or you have poor fetal reflexes. That's when you should provide intervention when you examine that animal at first. If everything's totally normal at first exam, you really just want to monitor progress, and you want to ensure that progression is occurring every 30 minutes. And if you're not getting progress, or the calf has poor signs of vigor, then you should intervene. The next thing that's associated with stillbirth rate or prevalence of dystocia is nutrition. And it's really important that we provide, obviously, really good nutrition in the last trimester of gestation, not only for the transition cow period, but also for ensuring that we have a good calf that's born. If we look at nutrition in the dry cow period, really the most important thing from a calf health perspective is that we feed them not in excess or not inadequate nutrition, especially in the last trimester. If we have excess nutrition, we're going to have a larger fetus that's born. We're also going to get the buildup of fat surrounding the birth canal. And what that will do is it'll decrease the diameter that we have to have this calf delivered, which you can see in the pelvis down here. It's also becoming an issue in cows that are dried off at a high body condition score. So there's many farms that use a one-group TMR. These cows are out in late lactation, not producing a significant amount of milk, and they're dried off at really fat body condition scores or high body condition scores. And because they don't lose weight over the dry cow period, they can be a significant challenge to having a calf at the next onset of the next lactation. Inadequate nutrition is also an important factor to consider as well, and maybe more important in heifers. So if we're not providing the cows or heifers with enough nutrition, we're going to reduce pelvic size. We're also going to get reduced placental and fetal weight, and that'll increase the risk of dystocia and perinatal mortality. And a lot of that is related to uterine inertia and also the inadequate relaxation of the pelvic ligaments. If we have micronutrient deficiencies, particularly deficiency in vitamin E and selenium, we also have a higher risk of perinatal mortality. So we really want to ensure that we have a well-balanced ration that we're feeding to cows in the dry cow period. One of the ways that we can monitor how well designed the nutritional program is through doing body condition scoring. So ideally, our body condition score goal at dry off is 3.5. Calving, it's 3.5 as well, and also heifers for calving is 3.5. So a really easy target is having 3.5 all the way through. So monitoring that, ensuring that they're reaching those goals is really an important way to ensure that the ration is balanced appropriately. The final thing that's associated with the stillbirth rate is heifers. Heifers broadly are at increased risk of having dystocia and also at increased risk of having a stillborn calf. And a lot of that is related to the age at which they're calving, but also the body weight at which they're calving as well. So like I mentioned earlier, first calf heifers are really at the highest risk of dystocia, and we really want to ensure that heifers are at the appropriate weight, also the appropriate age, and that will improve production. It'll also improve our efficiency and reduce the costs associated with rearing heifers, and ultimately will minimize the risk of dystocia and perinatal mortality. If we're focused purely at age and trying to optimize the age of first calving, again to improve our efficiency in our heifer rearing, our target age of first calving is anywhere between 22 to 24 months of age. When we calve them at between 22 to 24 months of age, we'll maximize the milk production, and we'll also reduce the risk of dystocia and reduce the risk of perinatal mortality. And this is important to note that it's lifetime milk production. However, just making a blanket statement about age really is not appropriate. We cannot forget about body weight. It really is a balance between age at first calving and weight at first calving. So if we calve out an animal at 500 kilos compared to an animal at 600 kilos, we get about a 3.8 liter per day increase in that animal that calved out at 600 kilos. So it's really, really important that we ensure that they're not only at the appropriate body weight, but they're also at the appropriate age, because we can maximize the efficiency while maximizing their milk production, especially in the first lactation. So if we look at breeding and calving targets, ideally we want to breed our heifers at 13 to 15 months. We want them to be 55% of mature body weight. And what mature body weight means is that we're measuring third or greater lactation animals to see what the mature size is in the specific herd. So ideally we want them to be about 55% of that. And we want them to be a hip height about 50 to 52 inches. And one of the ways that works really well in some of the herds I work with is by putting a red piece of tape on the headlocks or on the wall somewhere where you can see what their hip height is to make sure that they're appropriate size. At calving, we want them to be 22 to 24 months of age, which is about 85% of their mature body weight, and 53 to 56 inches at their withers. So just to conclude this bit on stillborn or stillbirth rates, stillbirth rates are a big challenge on many dairy farms. About 50% of dairy farms in Canada have a stillbirth rate that's greater than 5%. And I think that we really do need to address that on our herds. If we think about ways that we can manipulate or change our stillbirth rate, or even change the dystocia rate on herds, we can look at calving management, movement prior to calving, calving supervision, and calving intervention are all important areas that we can use to tackle this issue and reduce or improve the outcomes that we have with our difficult calvings. We can look at nutrition, ensuring that we're providing a well-balanced nutrition, especially in the third trimester. And the final thing we can look at is ensuring that our first lactation animals are well grown. So we're not only looking at the age at first calving, but we're also looking at the body weight at first calving. So the next section we'll talk about is colostrum management. I don't think I need to spend a lot of time talking about the importance of colostrum management, but I'll briefly go over it. So immunoglobulins in colostrum are important for disease protection. There's also a lot of bioactive components and hormones in colostrum that are really important for the development of the gut, especially in early life for the calf. If you look purely at the health consequences of having failed transfer of passive immunity or not absorbing enough immunoglobulins into the bloodstream, we're going to have several consequences. The first one is we have a 2 times greater risk of mortality. We have a 1.5 times greater risk of diarrhea, a 1.7 times greater 5.75 times greater risk of pneumonia, and a 2 times greater risk of the calf being treated with antimicrobials. So pretty substantial effects on the health side. If we cumulatively pull all that together, it's about $100 per calf that has failure of passive transfer in total. If you think about how common, poor colostrum management is on dairy farms, it is quite common. So this particular graph is from the National Dairy Study, again, surveyed about 1,000 dairy producers across Canada. And what they went out is they asked a pro-action requirement to the producers. Do you feed at least 4 liters of good quality colostrum within the first 12 hours? And what's surprising from this is that only 67% of producers said that they did. And 30% said that they sometimes did. A few producers said occasionally and never. If we look at how common failed transfer of passive immunity is, this past summer in 2019, we went out to about 110 dairy farms across Ontario and took blood samples to determine their levels of serum total protein. And about 25% of the 600 calves that we sampled had failed transfer of passive immunity. So it occurs quite commonly. So we have challenges with colostrum management and subsequent challenges with failed transfer of passive immunity. So how can we monitor it? Like I mentioned earlier, you can monitor it through the use of total protein, and you can take blood samples from 1 to 9 days of age. And this was a study that was done in 2018, where they went out and took serial samples of calves for 9 days or 10 days. And what they found was that IgG is well correlated to serum total protein from 1 to 9 days of age. And really what this is a marker of the overall success of the colostrum management program. If we use a cut point of 5.5 grams per deciliter, really anything greater than 20% is considered to be an alarm. If we look at this little video, it's really an easy thing that we can do on farms. It's really an easy way that we can monitor the success of passive transfer. And because it's so important for farms and their future health, I think it's something we really need to be monitoring. And the nice thing is when we have this data, we can graph it out and we can see what it looks like on different farms. So in this particular farm, you can see in 2016, 2017, and 2018, there's really no issue with failure of passive transfer. Really consistently below that 20% mark and doing really well. But the nice thing is when you're monitoring, you can identify when things go off the rails. And then you can go through a specific process to see what changed or what can be improved. So if you think about, when we're kind of exploring some of these challenges, it's really important that we have the conversations with the people that are actively taking care of the calves. So on this particular farm, it's a 500 cow farm. The person that I'm speaking with here is probably not the best person. This person's the overall manager and does not often look after the calves. So it's really important that you target your questions to the appropriate person to really identify what changed on the farm. If we think about the main factors that impact the success of passive transfer, there really are 4. There's the quantity of colostrum that they're providing, the quality of colostrum that they're providing, how quickly we're feeding the calves, and also how clean the colostrum is. And those 4 together will really improve the success of our passive transfer. If we start and focus on quantity and look at some of the newer research that's been done on it, really we should be feeding about 8.5 to 10% of body weight of colostrum at the first feeding. And that works out to about 3 to 4 liters at first feeding. Some newer research, and this is from one particular study, found that there's some evidence that 8.5% of body weight has some advantages, or 3 liters at the first feeding. When they did that, they had greater levels of serum IgG and also had a greater absorption efficacy. And what they're thinking was that, when we compare that 8.5 to 10%, feeding an 8.5% allowed for there to be more absorption of IgG, because we're not absorbing the capacity of the small intestine to absorb. And that's what led to a greater serum IgG. So really, this is only one study, but really the main recommendation or takeaway from this particular study is that feeding 3 liters might not have substantial harm, and really we should be feeding between that 3 to 4 liter mark. The next one is quality of colostrum. If we look at quality, poor quality colostrum is quite common in the dairy industry. This is a study that was done in 2012 where they went to 104 dairy farms across the United States, and they found about 26% of colostrum samples are poor quality. And the takeaway from this is that if you have producers that aren't monitoring this or aren't measuring it, whether it's individual, for feeding decisions, or as a herd level monitoring tool, we're probably missing about 25% of colostrum samples that are poor quality. So what is high quality? It's greater than 50 grams per liter of IgG. And the nice thing is we can measure it on farm really reliably and accurately. The best way to monitor it is by using a Brix refractometer. And you can see from this graph here that both our optical and digital Brix refractometers are really highly correlated to our IgG, that was measured through radial immunodiffusion. And a cut point using for the Brix refractometer, anything greater than 22% on the Brix scale is considered to be high quality colostrum, or greater than 50 grams per liter. Another way you can monitor is using a colostrometer. Greater than 80 milligrams per mil is considered to be high quality. However, the colostrometer is very temperature sensitive. So it'll overestimate the amount of IgG in colostrum when it's over room temperature, and it'll underestimate when it's colder than room temperature. So really the best thing to use is a Brix refractometer, optical or digital. And the nice thing is that opticals are really cheap and you can buy them, for a reasonable cost, around $50 to $60. The nice thing is if we're monitoring the quality of colostrum on farms, we also can make herd level decision making so that we can go in and we can explore why are we getting so many poor quality colostrum samples. So some of the things that you can dig into when you're seeing high levels of low quality colostrum is look at the time of first milking relative to calving. So this is a study that was done a while ago where they looked at the amount of immunoglobulins and then they looked at the time after calving. And basically the longer that you took to harvest the colostrum from the cow, the poorer the quality colostrum that you got. And that's actually due to the immunoglobulins being reabsorbed back into maternal circulation. So it's not a dilution effect, it's from the reabsorption of IgGs into maternal circulation. Having a high energy or vitamin E and selenium deficient diet in the prepartum period will also contribute to having low quality colostrum. Parity, if you collect colostrum from first and second lactation animals, you're going to have poorer quality colostrum than third or greater lactation animals. Having a short dry cow period will also contribute to having low quality colostrum. And that's because colostrum production begins about 5 weeks prior to parturition. So we want to ensure that we're having at least a dry cow period of at least 5 weeks, because if we have short dry cow periods that are less than that, we're not only going to have a reduced quantity of IgG, but also going to have a reduced volume of colostrum that's produced. Breed is also important. I think that's obviously a big challenge to change that on farm. You're not going to get a Holstein producer to change to a bunch of Jerseys, but Holsteins really do have the poorest amount or poorest quality of colostrum produced when we compare it to other breeds. Heat stress is also another important one. When cows are undergoing heat stress, they're going to have a lower volume of colostrum and also a lower amount of IgGs that's within their colostrum. And the final one is vaccination of cows in the prepartum period. So 3 to 6 weeks prior to calving, giving them a vaccine will improve the amount of antibodies that are specific to certain pathogens like E. coli, rotavirus, and coronavirus. The next thing that's impacting the success of passive transfer is how quickly we're providing colostrum after calving. So it's really important that we provide colostrum as quickly after calving as possible, because we have these immunoglobulins that are being absorbed across the small intestinal epithelium through penocytosis. And really the ability of the calf's enterocytes, or the intestine, to absorb these really quickly declines after birth. So for every hour delay after birth that we wait until we feed colostrum, the risk of failure passive transfer increases by about 13%. And really it's optimal to feed colostrum within 4 hours after birth. This is an interesting study just to further highlight that was done at the University of Guelph, where they fed colostrum immediately at birth, and you can see a huge rise in immunoglobulins. They fed them at 6 hours and also fed them at 12 hours. And you can see that the 6 and 12 hours are virtually identical. So the takeaway from this is really we want to feed them as soon as possible. So ideally, we want to feed them probably within the first 4 hours so that we can get that maximum amount of colostrum absorption. And waiting to 6 hours is just as bad as waiting to 12 hours to feed colostrum. The final thing impacting the success of passive transfer is cleanliness. I think cleanliness is often a forgotten part of those 4 critical things to have successful passive transfer. And why it's so important is that if we have bacteria in colostrum, it really interferes with the absorption of immunoglobulins. So basically what happens is we have bacteria that bind up those immunoglobulins and make it very difficult for that large molecule to cross the small intestinal epithelium by penocytosis. Also, if we have bacteria in colostrum, it'll increase the risk of diarrhea. So if we think about how we're doing in terms of colostrum contamination, we're really not doing so well. This is again from that study that I mentioned earlier from 2012, where they went out to 104 different dairy farms and collected colostrum samples. They sent it to a lab, and they did bacterial counts. And ideally, we want our bacterial count to be less than 100,000 coloniform units per mil. And as you can see here, only about 55% of samples were less than 100,000, actually meeting that cut point of being clean colostrum, and 17% were over 1 million, meaning that they're tremendously contaminated. So I think there's some room for improvement in this particular area. If we think about where contamination occurs, I think there's 4 critical areas that we can start exploring. The first one is the udder. So there's lots of cows that come through the dry cow period that have an udder that looks like this. So you want to make sure that they're well prepared. We're not getting manure that's contaminating or getting into our colostrum to contaminate it. We also want to make sure we have a clean collection bucket. So there's lots of farms that store this in the middle of their parlor. It gets covered with manure. They use it for waste milk. It's probably not appropriate when they're using it to collect colostrum into. So ensuring that we have a well-defined or one specific collection bucket that we use for colostrum can go a long way to preventing contamination. How we store colostrum is also important. So ensuring that we're either feeding colostrum right away or we're starting to cool the colostrum right away is really important. And the cooling part, especially if we're going to store it, is a really important management practice, because if we leave it at room temperature, we're going to, the multiplication of bacteria that happens within it. So cooling it, putting it in the fridge right away or putting it in the freezer right away is really important to prevent that bacterial growth. The final area where contamination could occur is through feeding equipment. And that's one of the areas that we explored. If we're looking at contamination of feeding equipment, it also occurs quite commonly. So if you remember, our gold standard of contamination is less than 100,000 CFUs per mil. Only about 41% of samples met that criteria. And we have about 35% that are over 1 million or really substantially contaminated. So we have lots of contamination of feeding equipment that's occurring. If we think about how we can monitor cleanliness on farm, like I spoke about earlier, you can submit samples to your local laboratory and get them to measure either total coliform count or total bacterial count. And some of the targets for that is to be less than 5,000 CFUs for total coliform count and less than 50,000 CFUs per mil of total bacterial count. One way that you can measure potentially contamination on farm is through using a luminometer. And what a luminometer is it measures the amount of ATP that's present in microbial cells. And we have an enzyme at the top in the swab here, you can see at the top here, that when it comes into contact with ATP, it'll start to generate light. And this luminometer will measure the amount of light that's being produced that's proportional to the amount of bacteria that's in there. So if I show you just the process of how we did it on farm. So you drop about 10 mils of this solution. You put it into your piece of feeding equipment that you're going to test, and you want to make sure that it's getting adequate surface coverage over everything. So it's similar to what the route that colostrum would go through. You collect it as an as-fed sample, so meaning out of the nipple bottle or out of the end of the esophageal tube feeder into a sterile collection container. Grab your swab, dip the swab into the fluid, and then you can see at the top here that there's a little bit of liquid at the top, and that contains the enzyme called luciferase that when it comes into contact with ATP, it'll start to fluoresce. So you allow it to sit for about 2 to 6 seconds, and then you put it in your luminometer, and it measures the amount of light that's being produced. And the nice thing here is that you get a result in about 15 seconds. So you can show your producer, hey, things are going well, or maybe things are not going so well. So this has been validated on running sterile saline through feeding equipment, so particularly nipple bottles and esophageal tube feeders, but you also could run it through other lines where you're running sterile saline through the lines in an automatic auto feeder or other things on the farm. Next topic of discussion that I often run into is what colostrum feeding method is best. Is it a nipple bottle or is it an esophageal tube feeder? So a couple of years ago, Mike Steele at the University of Alberta at that time went out and looked at, is there any difference between bottle and tube feeding when we feed them immediately after birth? And the answer to that is that there isn't. So serum IgG is the exact same for both bottle and tube when we're feeding them immediately at birth. The next question that I have, which really hasn't been researched, is what happens if we delay feeding colostrum, whether it's 6 hours or 10 hours, do we still see that similar effect? But the answer for colostrum feeding method, the best to our knowledge, is that there really is no difference between bottle and tube feeder. So some key takeaways from this colostrum management section is that obviously this colostrum management is really, really important. It's not only important to decrease the risk of health consequences that we have when we don't feed enough colostrum, but we also, risk running into some consequences of not having adequate gut development when we feed not enough colostrum to these calves. If we think about the 4 key things that we want to focus on to have successful colostrum management, it's really feeding adequate quantity of colostrum, making sure it's high quality, feeding it quickly after birth, and ensuring that it's clean. The nice thing is we can monitor many of these things, whether it's through taking total proteins to look at success passive transfer, whether it's looking at using a luminometer or using some laboratory submissions to determine bacterial counts, or even by evaluating quality of colostrum. We can monitor all those things so that we have informed discussions with our producers about what's going on their farm. The next section we'll go through is exploring calf mortality. I think calf mortality occurs quite commonly on many farms and is an area of opportunity that we can address. If you think about mortality rates in dairy calves, this is again from the National Dairy Study, which went out to 1,000 dairy farms and explored what the levels of mortality were. We have fairly high levels of pre-weaning mortality. About 6.4% of calves will die during the pre-wean period, and we have 2.5% of calves that die during the post-weaning period. So if we combine that with the calves that we lose, during the perinatal period from birth to 48 hours, we're losing about 15% of calves before calving. Okay, which I think is a significant issue on from a consumer perspective or from a welfare perspective. Another challenge from a welfare perspective is also the proportion of calves that are euthanized. If we look at during the pre-wean period, only about 10% of calves are euthanized, and 90% will die unassisted. So I think it's important that we have informed discussions with our producers on when the appropriate time is to euthanize calves, because I think this is a significant welfare issue. How do we monitor it? I think it's challenging on some dairy farms because the records can be challenging. But with new pro-action requirements, you'll need to record all mortality that happens on farm, so it might become a bit easier. Our goal for pre-weaning mortality is to be less than 3%. And as you can see, this farm is achieving that. And our goal for post-weaning mortality is less than 2%. And this farm particularly is not achieving that. So the nice thing is when you're monitoring that, again, you can have informed discussions with your producers to talk about how can we manage what's happening in terms of mortality on farm. So, and also when you're monitoring it, you can identify when things go off the rails, like this particular farm that had a challenge in the pre-wean period in 2019. So next question that you ask after you're doing all this monitoring for mortality is, why are these calves dying? And ideally you want to do postmortems on calves to identify that. But if you think about how many calves had a postmortem completed, especially during the pre-wean period, it's very rare. Only about 3% of farms reported doing a postmortem on their pre-wean calves. So I think that's another area that we can motivate producers to start identifying why are these calves dying, so we can put particularly structured management procedures or practices in place to reduce that. So why are these calves dying? The majority of calves that die during the pre-wean period are due to diarrhea. About 56% of calves will die due to diarrhea in the pre-wean period. So not only do calves die from diarrhea, but they also have consequences if they survive. So if we have a case of diarrhea in a calf, we're going to have reduced growth, we're going to increase age at first calving, and we're also going to reduce first lactation milk production. We're also have the consequence of having labor and treatment costs. And what this black circle down here at the bottom is insinuating is a labor and treatment cost for the average Ontario dairy farm that milks about 80 cows. So about $1,300 just purely in labor and treatment costs, not even looking at any of these other consequences. So how do we prevent diarrhea? Really the biggest thing that we can do is have proper colostrum management. Feeding good quality colostrum quickly after birth can be really important to reducing the level of diarrhea that we see. Having good nutrition is also important. So having high planes of nutrition has been associated with a reduced level of diarrhea and also improved recovery from diarrhea. Using some vaccinations, so dry cow vaccinations to bolster the specific antibodies against E. coli, rotavirus, and coronavirus can be important, as can using some boluses that we give at birth. Those can provide specific antibodies, again, to those specific pathogens. And finally, ensuring that we have a clean housing area and we're feeding these calves with clean feeding equipment can go a long way to preventing diarrhea. There's also some building evidence or interest in using nutritional supplements to prevent diarrhea. So some of the newer work that's been done has been on colostrum replacers, probiotics, and also IgY antibody products. If we focus specifically on colostrum replacer, feeding about 70 grams of colostrum replacer in milk for the first 14 days has been associated with a lower level of diarrhea, lower level of antimicrobial treatments, and also improved pre-weaning weight gain. Looking at probiotics, there's been a meta-analysis which is pulling literature from multiple different papers together to look at the effect of probiotics. What they found is that when you're feeding lactic acid bacteria in the diet, it also led to a reduction in diarrhea in the pre-wean period. IgY antibody products, which are produced from laying hens where you vaccinate against E. coli, rotavirus, coronavirus, and then you isolate that egg yolk. Supplementation with this product led to a reduced level of diarrhea or mortality when evaluated using a meta-analysis. So there's definitely some work that's showing these nutritional supplements can help to prevent diarrhea and hopefully can reduce levels of mortality and also reduce levels of antimicrobial use that we'll talk about in a sec. So switching gears to respiratory disease, many calves die during the post-weaning period due to respiratory disease. So this is a significant challenge, and I think it needs to also be addressed. Also, if the calves survive a case of respiratory disease, they'll also have those challenges like we talked about earlier with diarrhea. So if they survive a case of respiratory disease, they're still going to have reduced growth. They'll reduce first lactation milk production, about 600 kilogram reduction, and they'll also have reduced reproductive performance. And similar to diarrhea, if we just purely look at labor and treatment costs, it costs the average Ontario dairy farm about $3,700 per year. So how do we prevent diarrhea or respiratory disease? I think there's two main things that we can look at. The first one is the housing environment that they're in, and the second one is the vaccines that we're using on the calves. So if you look at housing, I think having an ample amount of bedding is really crucial. And if we can allow these calves to nest, like seen here, where their legs are not visible when they're lying down, it can really provide a crucial role in aiding in thermoregulation. So we can prevent these calves from being chilled, prevent drafting also, so that we can improve the ability of the innate immune system to work and prevent respiratory disease. Next thing is stocking density, and there's a long formula here, which I won't go into great detail about. But if we ensure that we have the appropriate stocking density for the environment, we also can ensure that we have good air, don't have high levels of ammonia, we don't build up humidity, and that can help to prevent respiratory disease. Ventilation is absolutely critical, and delivering air, especially with no draft, is really important. So using positive pressure ventilation can be really important to preventing respiratory disease. Ideally, in the wintertime, we also want to see about 4 air changes per hour to minimize ammonia buildup and humidity. The final thing that we can do to manage the environment is ensuring that we have proper drainage. If we have inadequate drainage, we have the buildup of urine and other liquid that can lead to high levels of ammonia and humidity. So this may be a discussion, when barns are being built, to ensure that we have proper drainage for all the liquid that's being built up. The other thing we can do to prevent respiratory disease is ensure that we have a good vaccination strategy. So it's important to note that maternal antibodies, they build up over time from colostrum and then decline, and it still takes a while for the calf's own immune system to start to build. So we have this window of susceptibility that occurs anywhere between 3 to 6 weeks after life or after birth. So what we can do is we can use vaccines or vaccination strategies to hopefully get us through that window of susceptibility. So intranasal vaccines are really a great tool that we can use to stimulate mucosal immune system, get that buildup of IgA, and really prevent infection from occurring, because it's tackling at the level of the nostrils before it actually goes into the lungs. Some new research has also shown that following an initial intranasal dose of vaccine, it can actually lead to a better immune memory and more immunogenic response when we follow up with a parental or injectable vaccination. Intranasal vaccines are also not subject to maternal antibody interference, and they have a little bit of a shorter duration of immunity, about 9 weeks in total. If we look at some of the evidence that's out there for these intranasal vaccines, the majority has been on viral vaccines that cover BSV, IBR, and PI3. They've done challenge studies where they've challenged calves with those 3 viral pathogens, and what they found is that vaccinated calves were less depressed, had lower percentages of diseased lung, and higher oxygen saturation compared to those that were not vaccinated. So under a challenge environment, it shows that it works quite well. If we look at field-based studies, the field-based studies have found that there's no reduction in clinical disease, but they actually found a lower probability of consolidated lung when they're using ultrasound, which is really a significant result, because if we have consolidated lung, it will lead to lower milk production and first lactation. Just to highlight the differences they found in that trial, so if they vaccinated with the intranasal vaccine, only about 41% of calves had lung consolidation, compared to the unvaccinated controls, about 77% had lung consolidation. So pretty significant difference there. Parental vaccines can also be used to aid in reducing respiratory disease, but the challenges in these young calves is that we have high levels of maternal-derived antibodies through colostrum, and those will bind and interfere with vaccine antigens. So we don't get an effective immune response to the vaccine. So the newest science is saying that we should wait at least 2 weeks minimum, and I'd suggest probably waiting a little bit longer than that for the use of parental vaccines. The challenge also with parental vaccines is a lot of the studies have been done on challenge models, which are not totally applicable to commercial situations. So that needs to be taken into consideration when thinking about parental vaccines. So at least 2 weeks minimum. I would suggest probably closer to 3 months minimum. So why are these calves dying? So the third most common cause of mortality in the pre-wean period is umbilical infections. And I think umbilical infections are really an underdiagnosed disease on many dairy farms. So if you think about the umbilicus, very vascular structure, that has a lot of blood flow going to it prior to birth and even after birth. And really, if we get bacteria that are going to the umbilical stalk, it's really a pathway into the rest of the body. So we get infection of umbilical arteries, umbilical vein, we get peritonitis, we get septicemia, a large number of different consequences. And here's just some pictures of what it looks like. So here's some momentum that's adhesed to the umbilical arteries, and here's widespread peritonitis that was from an umbilical infection. If we look how common it is, or umbilical infections are, they really are quite common. So these are from 2 different studies. One done in male calves, they found about 26% of calves had an enlarged umbilicus with heat, pain, or moisture that was present. And this study from the US found that about 27% of female calves had enlarged umbilicus with heat, pain, and swelling. So it really is a common occurrence on many farms, but I think, again, it's an underdiagnosed disease. So how do we manage umbilicuses so that we can prevent umbilical infection? I think the most important thing that we can do is ensure that the calving area is as clean as possible. But the challenge is identified by the National Dairy Study is that many calving areas are not kind of perfect on many dairy farms. So if we look at some of the results from the National Dairy Study, about 83% of producers said they did not remove the calf within 30 minutes after birth, 11% used the calving area for sick or lame cows, and 24% never cleaned the calving area. So with the buildup of manure, and again, that umbilicus being really a pathway through the rest of the body, if we get bacterial infection that occurs there, it really can lead to some serious consequences. Other things that we can do is ensure that we have appropriate colostrum management, and also ensure that the housing area that we're moving these animals into is as clean and dry as possible. So again, we can prevent bacteria from entering into the umbilicus. So I'm sure some of you are asking, well, what about umbilical disinfection? I didn't really talk about that too much. And that's because there really is little that's known about the effectiveness of umbilical disinfection. What we do know is that there's really similar efficacy between 2% chlorhexidine solution and 7% iodine solution, but we really don't know if 2% chlorhexidine or 7% iodine is effective when we compare it to nothing. And it might not be without risk, so there's 2 studies that identified that there's an association between using umbilical disinfection and a higher prevalence of respiratory disease. So as a takeaway from this section, calf mortality occurs quite commonly on Canadian dairy farms. We have 6.5% of calves will die during the pre-wean period, and 2.5% of calves will die during the post-weaning period. It's really important, again, that we monitor this through producer records, and we monitor over time so we can identify when issues occur, and also doing post-mortem so we can identify the specific cause of disease. If you think of the common causes of disease, majority is due to diarrhea, pneumonia, and also umbilical infections. And I think, again, if we can identify those specific causes, we can put specific management practices in place to address them properly. So the next section that we'll explore is morbidity on dairy farms. With all the emphasis around antimicrobial use and subsequent antimicrobial resistance, I think this is a really important area that veterinarians can tackle. If we think about how common morbidity is on dairy farms, again, it is quite common. This isn't Canadian data because we really don't have good Canadian information on these levels of disease. So this is from the US and the USDA NOMS work. And what they found was that about 22% of calves have diarrhea in the pre-wean period, about 12.5% of calves have pneumonia during the pre-wean period, and 3% of calves have naval infections. If we look at the post-weaning period, about 1% of calves have diarrhea, and 5% of calves have pneumonia. So quite common that many calves get treated for disease. If you look at treatment with antibiotics, which is really where we want to focus on ensuring that we have prudent antimicrobial use, we can see that about 75% of calves with diarrhea get treated with antibiotics. And I think that's a really big area that we can educate producers on when to appropriately use antibiotics. Majority of cows get treated with antibiotics for pneumonia, which makes sense, and same with naval infections. So diarrhea is a really big focus on where we can have, discussion with producers about prudent antimicrobial use. If you look at some of the antibiotics that are used for treatment, again, this is from the USDA, so not totally applicable to Canada, but we have many, category 1 antimicrobials like ceftiofur and fluoroquinolone that are commonly used to treat diarrhea. So again, I think there's some other reasonable options like trimethoprim sulfa that we can use to really treat diarrhea well. If you look at pneumonia, majority of producers use fluorophenocal and use macrolides, which again are not of high importance to human health, suggesting that we're having fairly good antibiotic choices in pneumonia treatment. So how can we monitor disease on farms? I think using treatment records is really ideal. But many of the farms that I've seen or been on really don't have great records for treatments. An indirect way that you can monitor is using dispensing of veterinary products and really see if they have high levels, of fluorophenocal that they're using during a certain period of time that might alert you to an issue occurring on the farm. But that's really an indirect way to monitor it. One of the other ways you could do it is using examination at using a standardized health exam, maybe at Herd Health with one of your technicians using this Calf Health Score app. And this calf health score wrap is a really great way that we can use ensure that our health exams are standardized. It evaluates the nasal discharge, ocular discharge, ear, attitude, cough, temperature, fecal score, navel, and joint. So it really is a whole kind of gamut that you'd want to examine on a calf. And you also can export all this information into an Excel spreadsheet so you can monitor the results over time. So again, another indirect way, but at least every 2 weeks you're monitoring what's happening on that farm. So again, one of the most common diseases that we see in dairy calves is diarrhea. And I think it's one way that we can, or one thing that we can educate producers on how to appropriately identify them and also how to appropriately treat them. So identifying calves with diarrhea, it's fairly straightforward, as you can see from this picture, ensuring that or identifying them that they have a fecal score of 2 or a fecal score of 3 is considered to be abnormal. You also want to look at their attitude because a lot of signs of depression in diuretic calves may help to identify dehydration. And then for dehydration levels, so evaluating the skin tint, looking at eye recession can be really important to really identify what we should do with this calf. Should we give it oral electrolytes, or do we need to give intravenous fluid therapy when they're over 8% dehydrated? Temperature is also another important thing to look at, so greater than 39.5 degrees Celsius, and we'll talk about that in a sec. So when we look at treatment, really fluid therapy is absolute importance. It's the most critical thing that we can do to manage a diuretic case. And really, oral electrolytes are really the hallmark of treating diarrhea. And they're really indicated in any calf that shows signs of diarrhea. They don't necessarily have to be dehydrated, but if they have the ongoing losses, they have diarrhea that's occurring, they're losing obviously a tremendous amount of fluid, they're also losing electrolytes. It's really important that we start to provide oral fluid therapy so that we can replace those ongoing losses. There's many different electrolytes that are available on the market. And really the key ingredients to evaluate is sodium. Sodium will help to kind of rebalance some of the electrolytes that's happening in the bloodstream. Glucose will help to with the absorption of sodium that happens. Evaluating the alkalizing agents, whether that's acetate, propionate, or bicarbonate, is important. Specifically with bicarbonate, because we don't want to feed electrolyte with bicarbonate immediately after a milk meal because it'll interfere with milk digestion. We also want to evaluate chloride and also potassium. And a good paper that you can look at is this Smith from 2009 Vet Clinics of North America paper that looked at the treatment of calf diarrhea, looking at oral fluid therapy. Another question that is often posed is what about milk feeding? Should we continue it when we're providing oral electrolytes? And the answer is yes. Milk feeding should continue in diuretic calves because when you feed that milk continuously, it'll actually improve weight gain. However, it's not beneficial to force feed milk. So only provide milk if the calves are going to drink it. It's also important when we're having that continued milk feeding that we have appropriate timing of electrolyte feeding. Ideally, it's perfect if we could have 4 feedings that are spread out throughout the day. We have 2 with milk and 2 with electrolytes. If we, again, going back to those electrolyte ingredients, it's important to look at the alkalizing agents. If we have electrolytes with acetate and propionate, they can be fed immediately after milk feeding. However, if we have electrolytes that contain bicarbonate as their alkalizing agent, we really want to wait 2 to 4 hours after milk feeding. And the reason for that is that it interferes with milk digestion. So it's thought to interfere with the clot formation of the abomasum so that we don't have that proper digestion of milk. So other things for fluid therapy, obviously IV fluids are really important as well when calves are greater than 8% dehydrated. So this is a really simplified chart that you could use with producers. Calf appears standing and strong, just give oral electrolyte solutions. However, if the calf is weak, greater than 8% dehydrated, if it's less than 1 week of age, it doesn't need as high levels of bicarbonate. So typically 5 liters of saline with 250 milliequivalents of bicarbonate added, along with oral electrolyte solution can help. If the calf is greater than 1 week of age, 5 liters of saline with 500 milliequivalents of bicarbonate. If the calf is unable to stand, that calf really does need a high level of bicarbonate, so 5 liters of saline with 500 milliequivalents, and also that continued electrolyte feeding. Additional therapies that you want to provide in a calf with diarrhea are anti-inflammatories. So a study that was done in Guelph used meloxicam and found that using meloxicam in calves with diarrhea led to improved body weight gain. It led to improved hydration score and also improved fecal score, so faster recovery from diarrhea. And a lot of that is driven off of improved consumption of milk, also improved consumption of starter and water, which really helped these calves recover quicker. The final thing to consider is antibiotics. So when you have a calf with diarrhea, not all calves with diarrhea need to be treated with antibiotics. Only about 30% of diuretic calves are going to be bacteremic. So this is a chart that was made by Scott Weiss and Diego Gomez at the University of Guelph, which I think really highlights well when we should be using antibiotics. So if the calf's bright and alert, drinking well, you really just want to monitor demeanor and milk intake while providing oral electrolytes. If they have blood in their stool, it's suggested to go to antimicrobial agents right away. If they're dull, drinking slowly, less than 30% of expected, but they have a fever, antimicrobial agents. If they do not have a fever, just monitor their demeanor. And finally, if they have marked depression, not drinking well, have a fever, antimicrobial agents, and if they don't, monitor demeanor and recheck their temperature within 12 hours. If we switch off to respiratory disease and look at the treatment associated or the identification associated with that, there's many options that we can use to identify calves with respiratory disease, but a lot of them have very differing performances. So just an example here, thoracic ultrasound is really the gold standard in identifying calves with disease. This is thoracic ultrasound here, and what you can see is that we grossly underdiagnose disease if we just rely on thoracic ultrasound alone. If we use clinical scoring charts, like I'll show in a second, those will lead to a little bit of overdiagnosis and a little bit underdiagnosis, but really it's the best thing that we can do when we're educating producers on farm on how to find a calf with pneumonia. So here's a particular chart that's really useful. And it's really not as subjective as some of the other scoring charts that are available. And really it's a score of, normal or abnormal. And there's really, if the calf has a, nasal discharge at any point, it's going to be considered to be abnormal. It also weights some of the different scoring or different criteria differently. So eye discharge only 2, nasal discharge is 4, ear droop or head tilt is 5, and so forth and so on, and takes into consideration the breathing speed as well. And if you add up all the scores together, if the score is greater than or equal to 5, the calf's positive for respiratory disease. So it's really a standardized way in which we can evaluate calves for respiratory disease. It's also an app that you can get on your iPhone or also on your from the Google Play Store. So when treating calves with antibiotics, one of the important considerations that we need to think about is providing antibiotics. And when we're using a standardized scoring system like this one, we know for sure that we need to provide antibiotics when the score is greater than or equal to 5. There's very little work that's gone into looking at the different antibiotic products that we can provide in calves with respiratory disease. So this is one from a feedlot study. And what they found was that there's really very little difference between, fluorphenicol, danrofloxacin, enrofloxacin, or tilthromycin. So they suggested that really any of these products can be efficacious when we're treating respiratory disease. So probably the takeaway from that study is that we really shouldn't be relying on these high category antimicrobials like enrofloxacin and danrofloxacin to treat respiratory disease, especially as a first line, and could be using some of the other products like fluorphenicol, tilthromycin, gamothromycin, and so forth and so on. Also, when we're treating respiratory disease, anti-inflammatory drugs can be offered and do have some substantial benefits. So this is again from a beef study, but they had reduction in rectal temperature, reduced lung consolidation when they provided anti-inflammatory drugs. They don't have, tremendous effects on growth or productivity. They're really inconsistent in the literature, and they do have minimal effects on other clinical signs. But really, just that reduction in rectal temperature, making that calf feel better, and also reducing lung consolidation, I think it's justified to provide. So just to wrap up this section on morbidity in calves, again, it happens very commonly. So we have 20% of calves being treated for diarrhea, 12.5% of calves being treated for pneumonia, and 3% of calves being treated for naval infections just in the pre-wean period. So I think as we move into this realm of prudent antimicrobial use, ensuring that we have good calf welfare, I think it's really important that we reduce these levels. And we reduce these levels through some of the stuff that we talked about earlier, good colostrum management, good nutrition, good housing, which can go, again, a long way to reducing the prevalence of those diseases. I also think if you look at, how commonly antibiotics are being used on farm, especially for diarrhea, where 75% of cases of diarrhea are treated with antibiotics, I think there's a room to have a discussion with your producer about prudent antimicrobial use. And following a flowchart that you make where they're only treating them when they, are dull or depressed or clinically affected with diarrhea. Fluid therapy obviously is really important with diarrhea, and providing oral electrolytes as soon as the calves are showing, signs of diarrhea, even if they're still bright and alert, can really prevent some of those negative effects that we see with diarrhea. And finally, for respiratory disease, using some of the clinical scoring charts so that calves are being examined in a standardized way can be really helpful for producers to identify calves with respiratory disease early. So if we combine all those together, I think there's a really big opportunity for veterinarians to talk and discuss about protocols on farm, especially in the pre-weaned area for diarrhea and respiratory disease. So calf nutrition is the final area of opportunity that I think we have in calf health management. Just to kind of highlight some of the research that's been done in terms of evaluating nutrition in the pre-wean period, a higher nutritional plan has been associated with a reduced level of diarrhea, improved recovery from diarrhea, higher average daily gain, higher feed efficiency, reduced age at sexual maturity, reduced age at first calving, higher first lactation milk yield. So pretty substantial benefits when we provide a higher nutritional plan in the pre-wean period. So if you think about what that nutritional plan means, it's about anywhere between 8 to 12 liters of milk per day that we can provide to see some of those benefits. If we again look at the National Dairy Study and look at, how common or what proportion of producers will feed 8 liters of milk a day or more, the average amount of milk or maximum amount of milk that's fed per day by an average dairy producer in Canada is about 8 liters, which is really a good news story. So, 50% provide 8 liters or more, but we still have this small proportion that provide a traditional restricted feeding of less than 4 liters per day. So the takeaway from that is that many producers are doing a really good job in ensuring that their nutrition is appropriate on their farm. How can we monitor nutrition? I don't think it has to be super fancy. If we're just looking at from a herd level basis, using a body weight tape is totally appropriate way to monitor nutrition on that farm and ensure that our calves are achieving this high growth rate. And if you think about in terms of our targets for growth rate, anywhere above 850 grams per day in the pre-wean period is considered to be a decent target to achieve, and anything over 1 kilogram per day in the post-wean period can be considered to be a good target. And as you can see from this farm, things are going well, and we don't really need to make any nutritional changes. So if you have the data, you can have those informed discussions with your producers. Just to further highlight the importance of pre-wean nutrition, there's a study that was done a little while ago where they looked at milk production in the first 305 days in milk and looked at average daily gain between 10 and 65 days of life. And what they found was that for every 100 grams per day increase that you had in average daily gain, it led to an additional 150 kilograms of milk in their first lactation. So changes in nutrition can lead to huge economic benefits for the producers. So again, going back to that monitoring, you have the data, you can have informed discussions. You can see on particular farms either if their growth rate declined to maybe a level like 600 grams per day, or if they're always at 600 grams per day, you can have that discussion about improving the volume of milk or changing how they're providing nutrition on their farm. So we think about when we're monitoring growth, again, having that information that we can go back and evaluate what their growth is. I think there are a couple key areas that we can focus on to improve their growth. The one is the amount of milk that they're providing. So in the pre-wean period, this is a majority of the nutrients that these calves are going to get. So we want to ensure that this is an appropriate nutritional source. So for volume of milk, again, a lot of those benefits are seen anywhere between 8 to 12 liters of milk that's consumed per day. If you might have some producers that are pushing back and saying, well, that's too much. I might have calves that they don't naturally drink that much, or they might get diarrhea. This is a study that was done nearly 18 years ago where they looked at feeding calves totally ad libitum, and you can see that calves will normally consume over 10 liters of milk per day. So I think it is pretty natural for these calves to consume a high volume of milk. If we look at feeding frequency, ideally you want to keep meals so that they're less than 4.5 liters per day or per feeding. That'll be ideal to really reduce abomasal damage, milk overflow into the rumen, any ruminal acidosis, and challenges with digestion that might occur. So that might be a barrier for some producers that are feeding twice a day. Ideally, feeding 4 liters, twice a day will get you to those benefits. And they don't really make bottles that are more than 4 liters, so that'll be a challenge for them to feed more than 4.5 liters. But that's something to keep in mind to ensure that we're not feeding more than 4.5 liters at a single feeding. If we look at increasing feeding frequency, so increasing the feeding frequency from 2 to 3 times per day without actually changing the volume of milk, in the wintertime it'll actually improve calf health and improve weight gain because we're keeping these calves warmer, we're providing them with an energy substrate, we're providing with a warm liquid, so that'll keep them warmer in the wintertime. However, there's really no change under thermal neutral conditions. So in the summertime, there's really no change, anywhere between 15 to 25 degrees Celsius. We have no change if we increase the feeding frequency. So it's really important in the wintertime. If we look at milk replacer or waste milk, milk versus milk replacer, there's not a lot of studies that have evaluated the differences between the two. If we look at milk replacer, it has substantially higher levels of lactose, which can be difficult for some calves to digest and can lead to higher levels of osmolality. However, there's a trade-off there where if we're feeding milk replacer, we have lower risk of transmission of both Johne's and leukosis. Waste milk really should not be fed on farms. They have higher levels of bacteria. It contains antimicrobials, which can generate antimicrobial resistance. But probably the biggest reason why not to feed waste milk is the variable quality that we have. So we have some cows that are producing the waste milk because they're been treated with antimicrobials. So we might have one cow one day, we might have another cow the next day, and maybe that first cow disappears. So we're going to have huge fluctuations in the fat and the protein for these calves, which will lead to poor growth ultimately. We also want to make sure that these calves have good solid feed intake to ensure that they're going to wean properly and be able to adapt to a solid-based diet or solid feed-based diet. How we can better prepare them for weaning is through pre-weaned housing. And there's some newer work that's showing that if we keep calves in group housing, we actually can improve their starter intake. So here's a study from a number of years ago where they looked at pair housing, so keeping calves together, comparing to single housing. And what they found was that if you keep calves paired, they'll actually start to consume starter faster and more frequently than calves that are housed individually. And a lot of that is related to when they're housed in pairs, they'll go and explore their environment a little bit more if they're housed in single housing. We also want to ensure that we're using a gradual weaning program so that we're weaning over a period of at least 2 weeks to ensure that we have good solid feed intake. And other best practices ensure that the calves are eating at least 1 kilogram of starter for 3 consecutive days. And this is another thing that we can monitor. So we can test it using a Precision Extra or just a BHBA monitor. And if they're consuming at least 0.2 millimoles per liter, if their blood BHBA is over 0.2 millimoles per liter, they've consumed at least 1 kilogram of starter for 3 consecutive days. Other best practices for weaning have a minimum of 3 weeks on starter and ensure that they have ab libitum water because that will drive their dry matter intake. Other key things when we're seeing, reduced growth or poor growth on farms is we want to consider, the environment that they're in. In the wintertime, we need to increase, their feeding rate by 25% to ensure that we meet those additional maintenance requirements for those calves to stay warm. So we need to, increase the volume of milk or even increase the amount of solids in milk to ensure that we're meeting those increased energy demands to stay warm. The final thing, if we're seeing poor growth, is also to evaluate, the level of disease on the farm. If they have high levels of disease, we often can see challenges with reduce growth. So just some takeaways from that particular area of nutrition. We need to feed higher planes of nutrition to achieve benefits like having improved growth rates, reduced level of disease, and improved first lactation milk production. We can really easily monitor growth just by taking a simple body weight tape, body weight measurement, and ensuring that we're achieving at least 850 grams per day in the pre-wean period and about 1,000 grams per day in the post-wean period. If we're exploring why we're seeing poor levels of growth or maybe inconsistency in growth, it's important to look at the amount of milk that they're being provided, what source of milk they're given, exploring the environmental temperatures that the calves are dealing with, ensuring we have good solid feed intake, and also we have reduced levels of disease. As we wind up this webinar series, I think it's important to touch base on a couple things. The first thing is, what do we do with all this data? So as we were moving through the entire webinar, I talked about ensuring that we're collecting information all the way through. So on stillbirth rates, failure passive transfer levels, body weight gain, levels of mortality, and levels of disease. So again, the nice thing when we have all this data, what can we can do with it is really have informed decision making with our producers. So we can frame the issue, ensure that we're doing it properly, we can ask the right questions, and then we can go forth and collect more information, look at that data, interpret the information, and have this decision making and communication with your producers. So that again, you're making really informed decision making on that farm so that you improve the health and welfare of the calves. Other things you can do with it is you can benchmark these producers. So there's a study that was done at UBC in 2018. And what they did was they collected failure passive transfer results. They also collected levels of average daily gain. And what they found was that the producers that got the information and made a change to their management with their veterinarian led to reduced levels of failure passive transfer and higher levels of average daily gain. And just a quote from that, from one of the producers, after the first report, we got all the data and was like, okay, there are other farms doing better. And we're doing pretty good, but we could be doing better. And I think that's one of the things that you'll get from your producers. When they see where their other peers rank, I think they can be an important motivator to get them to change. So some takeaway messages from this webinar series. I think calf health management is a huge area of opportunity. Whether it's calving management, colostrum management, mortality, disease, nutrition, and growth, I think these are all areas of focus that will really improve if we put some focus on them, they'll improve the efficiency and profitability of the farm and also improve the welfare and the health of the calves. Many of the factors can be influenced, like we talked about, through all of these areas of opportunity. And if you can monitor it, you can have that informed decision making with your producer to ensure you're walking through each one of these factors so that you can influence it appropriately. So with that, thanks for listening. If you have any questions, feel free to get a hold of me using this email, drenaud@acerconsult.ca. Thanks.